Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Lynn wants to know, would AIT help with verbal stimming? She is a 20-year-old who still stims verbally. And I just want to clarify, because you had said earlier, we all stim, and I think we all stim verbally. It's just the level to which and what it's preventing doing. But I'm assuming that it's pretty intense if she's bringing it up here.
Yeah. So auditory integration training, AIT, could help. It could also hurt. I just want to realistically tell you my experience with AIT. So back in, God, I don't even know, the 90s, I guess, maybe, AIT was a very hot topic, and a lot of people were trying auditory integration training, and I'll talk about it very quickly here. It is modulated music. So basically it's music, just, I remember in those days it was like Barry Manilow, and it was modulated. So various frequencies of sound are taken out and others are enhanced. So it kind of sounds like that, right? And the theory of AIT, and there were two types. There's Tomatis and there's Berard, and they're on different schedules, but they basically do the same thing. The theory of it is that you would do an audiogram with the child, and the audiogram, which is kind of a very detailed hearing test, and it would tell you what frequencies of sound your child is unable to hear. In other words, there are hair cells in the inner ear which are not responding to sound, and specific frequencies of sound. Now, with typically developing people, those inner hair cells of the inner ear respond to sound. They vibrate against parts of the inner ear, and that's how you hear sound. So if those hair cells are not responding to certain frequencies, the idea is that we want to activate them, and we want to make them active. And we do that, or people believed that it would be done through AIT, which is a series of, if I remember correctly, now I don't remember, but Berard had I think 1 or 2 rounds of, I want to say 8 sessions. Tomatis had 3 rounds, and it was 15 sessions, 10 sessions, it was something like that. And basically you'd go through, and your child would be they would first do the audiogram, which would identify which specific frequencies apply to your child. And unfortunately, with a lot of our kids, it's impossible to determine that because they don't have the ability to tell you. So therefore, they had developed a standard autism audiogram, which I didn't like that. But anyway, that would then give you certain modulated sounds, and they'd put headphones on your child, and your child would just sit there and listen to this music. And that would happen at whatever schedule they wanted. And then afterwards, the results should have been that it would accelerate language, because now the child is hearing certain things and possibly reduce some verbal self-stimulatory behaviors. I will say that I saw that it helped slightly in accelerating language for some kids, because they did start to hear more, kind of balanced. But in some cases, it actually increased verbal self-stimulatory behavior. And I wonder if that was because it just kind of backfired. The frequencies that were given to particular children were not the appropriate frequencies. And therefore, the child now started to self-stimulate a little bit more. If it was my child, I don't know that I would risk that. So I would always still want to figure out how I can kind of help the child control the sounds. There's a lot of behavioral things. You can have various time frames where the child is allowed to do various sounds at home. Let's say singing is one way that the child can actually get out all their needs for that sort of thing.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.